next what we are going to see is about the spleen. Now, although we see it in the abdominal cavity, you would not say it is part of the gastrointestinal tract mainly. It is part of the lymphatic system. Okay, that is a blood vascular system. Okay, now you have heard of the word spleen. Okay, what is the function of the spleen? You have learned a bit in your physiology. You know that the organ which is going to produce blood cells during your fetal life, that would be the spleen, unlike your bone marrow after birth. Okay, and what else does it do? You have also heard there is a phrase, the graveyard of the RBCs. What does it mean? It is going to destroy the unwanted or the old or the deformed RBCs that are going to pass through the blood. Basically, as in your lymphatic system, it is going to act as a checkpoint for the blood which is passing through it. So when the blood passes through it, whatever abnormal cells are there or the microbes are there, it's going to kill it. So when the microbes are there, it will let through its lymphatic, as you have your lymphocytes, B lymphocytes, T lymphocytes and macrophages, all these are there. So it is also going to play an important role in your immune system. Okay, so it produces blood, fetal life, it destroys abnormal blood, later on life, it helps in the immune system as to activate the immune system. Okay, so these kind of various, and it helps to also store a lot of blood. Okay, at a time a lot of blood would be there within the spleen. Okay, so the spleen, clinically, how is it important? If you remove this organ which is going to do all these functions, okay, can you survive? Think about it. Can you survive? Yes. In certain conditions, you would have to do a splenectomy. It is a treatment of certain conditions like your thalassemias and all, in which once it is removed, even though the normal cells in that person's body are sickle shaped or abnormal, they will still have to be circulating. So you are going to remove this checkpoint and keep it away. So that is, you are going to do a splenectomy, that is removal of the spleen. Okay, and another condition is you are going to have, sometimes a spleen can get ruptured during a road traffic accident. Okay, and if a lot of blood will be accumulating in your abdomen, you will not know anything, you won't see anything. The patient comes to you, he looks quite normal. Sometimes he may have a rib fracture or a hit on the left hypochondrial region where it would have fractured his ribs maybe, but that ribs will go and hit against the spleen and cause a rupture there. Bleeding will occur in the abdomen. Suddenly he'll just collapse. Okay, so you have to be alert about such a condition. This can happen only if you know where the spleen is. Okay, so if you get the spleen as a question for your exams, you're going to first of all say, how would you define it? You could say it is a wedge shaped organ which is maybe a bit purplish in color, and it is seen in which area? It is seen in the left hypochondrial region mainly, and it's part of your lymphatic system.